Underspending on service delivery, but overspending by almost R1 billion on the remuneration of public servants. These startling revelations were revealed by National Treasury officials before the Select Committee on Finance.
The National Treasury was presenting preliminary budget outcomes of the Free State and Gauteng governments for the year 2017 and 2018. In Gauteng, a large share of the budget goes to remuneration of education and health officials, and Treasury outlined the rot in the health department.
The big issue in this health department, is really around governance issues. Instability in senior management positions, which creates, a situation of uncertainty and all of that. Because I think in the last 7 years, this department has had about 5 accounting officers, which creates that instability, I believe, in the department. And this, we believe, is an issue that ought to be corrected at the political level. And then the high levels of irregular expenditure again in this department, simply non-compliance with SCM legislation and all of that, which is around 9 billion.
Things are worse at Gauteng Human Settlement Department.
If we look at 17-18, over 1.5 billion was actually spent in 1 month. And actually it's not even spending because it's just simple transfers to entities and so forth. About 854 million was actually transferred to the Housing Development Agency in that 1 month. And that is a very, very, very big concern for us. Because this thing, if you look at the graph below that, it then shows that actually service delivery is dropping, it's going down. In terms of the number of houses, the number of service stands, that is actually dropping. But then you can see then expenditure then going in the opposite direction.
Gauteng has also been slated for failing to pay suppliers, while millions are returned to the Treasury.
If we look at Gauteng, for instance, Department of Health, that department is projecting is underspending by 204 million. But here they have got 6.8 billion in unpaid invoices. So that money should then come from, there are issues around cash management and all of that. But again, the service in health being demand-driven. When patient comes to hospital, you turn them back, and all that. So the point is, you've got unpaid invoices, 6.8 billion, and in the province, in total, is around 9.5 billion.
Government prescribes that suppliers must be paid within 30 days for any undisputed invoices. In almost all provinces, that is not happening. Treasury suggested that unless there are consequences against transgressors, the situation is unlikely to improve. Manelisi Tubase, SABC News, Parliament.